Welcome to UX Banter Season 7, where design leaders, innovators, and change makers share their stories, insights, and passion for human centered experiences. This season, we are exploring AI driven design, inclusive UX, enterprise strategy, and the evolving role of designers in a rapidly changing world. I'm your host, Dushyant Kanungo. This podcast is presented by Galaxy UX Studio and powered by Galaxy Weblinks, an Inc. 5000 company. Hello, everyone. Welcome to another episode of the UX Banter podcast new season. This time, we have an amazing lineup of guests with your host, who is Dushyant Kanungo, that's myself. And our guest today is a UX leader with over 17 years of experience across healthcare, banking, and insurance, with a background in computer science and a master's in psychology. He works at the intersection of technology, human behavior, and business strategy. As head of UX, he has led UX, UI, and research teams for organizations including Deloitte, Novartis, and Sutherland Healthcare. He's currently advancing designs with the US healthcare insurance space. He mentored over 200 designers and served as a jury member for the National Design Awards in 2022. Please welcome user experience and product design lead at Data D Solutions, Feras Abdul Khayum.
Hey, hi, Christian. Good morning. Thanks for having me.
Finally, after a lot of back and forth that we have had, it's my apologies about keeping the appointments and the calendar straight up. But I hope that, this time around, third time is a charm.
No worries. Yes, absolutely. Yes, we meet at last.
So it's an interesting pathway and the journey that you have been on. Can you tell us what is the origin story? Where you were born, where you grew up, where you went to school, and how did you become the design leader that you are today?
Sure. So, I'm from India. Hyderabad. I was born and brought up over there. Did my schooling in a school around Hyderabad itself. And I've done my engineering and also my master's in psychology recently. Having said about all this, I would like to go back to where I actually got started with the UX design. Basically, I and my one of my friend, we had started up a company back in 2008, where we were trying to work for the Middle East clients, trying to build applications for them which were in the space of hotel management and hospitals. And that is where I was playing kind of a account manager role, where I was not just speaking to the clients, but I was also trying to understand the requirements and gather it for the team back in India. And my predominant role was how I can lead these developers that were working for me, and just be able to tell them what kind of design is expected out of the requirements that were given to me, right? So I was translating these requirements to the designs. Back then, I didn't know what UX was, right? I was like just doing the design and suggesting them what needs to be done, but I didn't know that term UX was already there out in the market, and I was actually doing UX when I was actually doing this kind of, or playing this kind of role, right? So then I realized that once I did like a couple of projects with the same kind of role and responsibilities, I understood that what I'm actually doing is user experience. A lot of organizations out there, back then it's only like the top organizations used to have teams around UX, and not everyone knew about UX. So I was more curious to understand what else do these guys do, right? So, and when I learned about this, I learned that UX is not just about designing. It is about how you understand your users, how you understand the business that you're working for, and put yourself in their shoes and be able to design something that could be used by those people, and not just depend on what your perception is about the design or the requirements that you're actually designing. So that's how I started learning a lot about UX. And then luckily, one day I got a chance to work with Deloitte, where they had an opening for a UX designer. And then that's how my journey started off as in the corporate world as a UX designer, and worked with them with Deloitte for nearly 3 years, and then worked with many other several companies for the last 17 years now.
Great. So during this period that you've been working with the enterprise zone and big consulting firms, do you think that you feel like you missed out on the agency pattern bucket in which a lot of UX design grunt work takes place?
When I was working with Deloitte, I did work kind of in an agency mode as well. It's not that I was completely lost with the corporate world where things are more, straightforward and stuff like those. I did work when I was working with Deloitte. Things were quite new in Deloitte as well back in India. So we were, collaborating a lot, having design brainstorming sessions and doing a lot of whiteboarding and discussing with the whole team. Even though we were working on different projects, each of us, I was taking care of tax and human resources related applications back then, if I remember well. But my colleagues were working on the other domains of the Deloitte. So we used to collaborate a lot. We used to do a lot of whiteboarding, learn from each other. When we get stuck in any kind of problem, which was something new, and see what new design pattern could be needed at that moment in time. We used to share those kind of ideas together, brainstorm, do research, see how research is done, ask from each other what they learned from their research, and things like those. So yeah, I think it was a mixed culture back then because it was kind of a startup for the team that I was working as well when
So
it comes to the user UX.
So it was the entire journey that was based on how you were discovering as things were progressing in the field,
Absolutely.
and at the same time defining and identifying the processes for UX in
Absolutely.
enterprise scenarios. So I
Correct.
think that has been the journey for anybody who is in the industry for more than 15, 20 years. 15 years is, I think, is the time frame that you can put
Right.
that they had to
Right.
hustle through and figure out what they can put in the pipeline. And
Absolutely.
right now you're working as in the insurance sector. Do you think that it's a niche that can be, should get the due that it deserves? Because insurance is, people just take it for granted that yes, we have to get it. There is no blockage in terms of that what the UX should be because everybody is obligated to have the insurance. But then
Right.
comes the user experience part. So,
Right.
do you think that there is an inherent responsibility that you carry, and how does it differentiate with other domains that you have worked in the past?
Right. Healthcare insurance is it's a very highly responsible in the industry itself is a very highly responsible industry, right? Because a lot of things actually, I mean, the whole country's healthcare depends on that, right? I specifically work on US healthcare for last like easily 7 years now, 6 to 7 years now. So what I learned from this is there are very large number of touch points here, right? It's not just what we think insurance is, where, as you said, right, it is mandatory to have insurance, and so you end up filling up the forms or whatever process that you need to do. But that's not the whole thing, right? In the back end, there's a lot of things happening there as well, right? Where there are things like who approves your insurance in first place. That's where it actually gets started, and then how your insurance is actually calculated, who's taking care of that kind of decisions. Then once there is any kind of episodes or any kind of treatment that is required for as patients, then how does this kind of request goes to the agents back from the insurance end, and how they respond, how quickly they respond, what are the kind of details that they need at that point in time to make some kind of decisions. So these all things are going on the background where a lot of experience is required, a lot of speed is required, and a lot of uh, error prevention is required, right? Like because these things are very time bound, and any error that they make, or any, if there is any kind of delay in making any kind of decision or making some wrong decision at the same time, can lead to even loss of life, right? So that's a very critical space that we work in. So definitely there are a lot of touch points where a lot of UX is actually highly required.
So the key term could be operational sufficiency or efficiency,
Right.
because you are dealing with the data which could be mission critical,
Right.
and the decision making has to be done on the fly.
Absolutely.
And that system, I think this is a good point of selling ROI for good user experience, that if the claims are processed or the application is coming as and when it is needed, and that is where the users will say, yes, we trust this service provider.
Right.
And this is the basis on which we are going to plan the entire life, or we would recommend others to join in because of the good amount of healthcare data that is being processed here.
Right.
Do you feel that the responsibility here is a double-edged one, that you also need to think about from not just the end clients, but your users are all enterprise users who have to be trained or sufficiently enabled enough to make a decision, informed decision based on the data points that you are showing?
Absolutely. Absolutely. That's well said, right? And that's the reason also there's a lot of AI involvement that is happening in the space of healthcare and insurance, healthcare insurance as well. So that is where one also is kind of a very challenging role when it comes to UX designer, because there are so many things that are happening out there. And as you know, this healthcare is kind of an ecosystem which all depends on trust, right? Like as a patient, how you go to the hospitals is all because of the trust, right? We trust whatever they
Right.
say, we trust any kind of treatment that they suggest, and things like those. So it's all depending on trust. So at the same time, as a UX designer, and when we are designing, any kind of applications or systems for these healthcare, be it insurance or be it clinicians, doctors, whoever it might be. Like I said, there are a lot of touch points out there, and they are also
Hmm.
encouraged to use AI in current situations, because that is actually not just like a helping hand for them now. It is kind of an augmentation in the space of healthcare, because that helps them to not just make decisions, but the right decisions as well, right? And know why they are making that kind of decisions as well, based on any kind of previous history, and all these kind of things considered, right?
All
So
right.
for us, as a UX designer, it becomes really very challenging to see how trust could be built in the application features that are powered by AI.
Before jumping into further conversation with AI or design and the bridge in the middle, I want to talk more on the lines of what you are about. So there are a few rapid fire questions that I'm going to ask to
Sure.
decode the math behind the design.
Absolutely. Yeah.
All right. So where do you live currently?
So I'm based out of Texas.
Texas,
For the last 3 years, yes, I'm based out of Texas,
Austin, or Dallas?
Dallas.
Dallas. Okay. What is your favorite recipe to cook?
Well, my favorite recipe, I'm really bad at cooking, but if I would like to cook, it would be pasta.
Pasta, not biryani. I mean, if coming from Hyderabad and stereotyping
Oh,
everybody, that has to be done the right way. So tea or coffee?
I would prefer tea daily, but once in a while coffee. Yeah.
All right. Mornings or sunsets?
I like sunsets.
Your favorite holiday destination?
When I was back in India it was Goa, and now it's Florida.
That's good choice. Even I like beaches more than mountains, but
Absolutely.
that's a very complicated history that Indians have with the entire beach culture, that we want to figure it out, but we can't. But that's one of the truths that is really hard to digest. Okay, and any book that you would like to recommend?
So I mean, there's a book called UX Principles. That is something that I mean, that helped me a lot, right? Like that helped me clear a lot of things. It has really good examples, and I forgot who it's written by, because I've read like this maybe like 5 6 years back. But that's really a great book to all the designers out there. Even if you're not a designer, it's great to learn all those things based on like how, based on psychology, how all these things are actually coming into existence. So I think that's a great book to read. UX Principles.
UX principles. Any movies that you would like to recommend?
Well, I like movies which are thrillers. So yeah, I think recently I watched a movie called Echo. It's EKO. That's
About dogs with dogs, right? Isn't
absolutely
that?
yes.
Yeah, yeah. I've heard great things about it. That
Yeah,
it is on my watch list
yeah,
because I'm a dog person. I have a lab, and
yeah,
definitely would love to watch it. All
yeah.
right. So coming back to the work and the core talks that we were having. So
Sure.
with anybody who would like to speak to Ferris in person, they know that he can be asked out for a cup of tea, or if you are a coffee person, occasionally he doesn't mind dwelling in. He is
Yes,
in Dallas, so if you are around, that is one way of decoding him.
correct.
If you invite him on a beach holiday, that would be a fun way of connecting. Then you guys can talk about UX.
Absolutely. Why not?
And if it's lunch, it is pasta. There you
Yeah,
are. All right. The problem right now that we all are facing, we have seen the entire design industry come from very different era to now where we stand right now. So there is a core differentiator that comes with designing with AI, and second is designing for AI. And that is a topic that is very close to my heart because on both the ends of the spectrum, we need to define the processes. So when I say designing with AI is something that every company and the designers have their own processes. What
right.
interests me is the other side of the spectrum. I have done about like 8 to 10 applications which were
Hmm.
AI enabled, AI driven ones. But
Right,
when they were none of them that I can recall which are as mission critical ones or with urgency as what you are working on.
right.
So,
Absolutely.
what does it take to design AI with healthcare in emergency situation is like, and what is your approach to it?
So basically, in the healthcare industry, if you want to design some kind of AI feature or a application or a product itself, whatever it might be, it requires a lot of understanding of who would be using this and why would they be using this, right? Like if say for example, it's someone at the insurance side who's sitting down there to make decisions based on any kind of claims that are coming up or pre-authorizations that are coming. So you need to think like this, that there is one patient who's sitting in the clinic and all of a sudden he has been diagnosed with something with very critical. It could be like very, very, chaotic situation that a person is in because he realized there's some situation with him and he or she is actually, being told that a treatment needs to be done, such kind of treatment needs to be done. And it's all time bound, right? Like it needs to be done in like a day or two, and or it could risk your life and things like those. Or even you're sitting with your kids in the clinic and you realize something of that sort, right? And then what happens is the operations team or the team front desk team from that particular clinic or hospital is actually sending a pre-auth, right? They are trying to identify that is your insurance covering the treatment that has been asked for, right? Are you eligible for the drugs that have been asked for from the doctor's end? So when all this process is happening, right, we need to put ourselves in their shoe and try to understand that what is important at this time, right? Like, is it that the person who's going to make the decision at the insurance end be aware of this kind of situation? How do they understand the severity of the situation, right? And what are the cues we can give in the design which can help them act really faster on this, or what else can we do to make this whole process faster, right? So I can give you an example around this, right? Like, so let's go back to the same scenario. So for example, I am a agent who's going to make a decision, a clinician who's going to make a decision based on my insurance plan a person is having and the severity of the situation, right? The AI would be able to help us to make a decision, right? I do not have. I mean, if I would do it by myself, I need to go through the whole situation, documentation, and what he or she is eligible for, not eligible for, drugs that they are eligible for, which are not eligible for. So it takes a lot of mammoth effort to go through all these things and make a decision, or it might take like 1 or 2 days itself, right? But at the same time, the AI can help us understand that, hey, this person has this kind of insurance, and the thing that has been asked for by the doctor is, you know, is the person is eligible for this, right? Without me reading any kind of documentation and all that, it just matches all those things and let me know that they're eligible for that. That is the first point, right? The second point is why they need this kind of treatment and all, right? All these kind of things as well. If the AI is going to tell the agent at the insurance end, then the whole decision making becomes a lot more faster and also trustworthy, because now the agent also or the clinician also knows that why this has been prescribed and how is this already covered in the insurance and how much would that cost roughly, out of the pocket for the patient, out of the pocket, from the insurance end. So these are the kind of things that could be, done in a jiff, right? Like the thing that used to take like 1 hour or 2 hours or sometimes 1 day or 2 days to get the whole thing fixed, it might take like not even 1 or 2 minutes. So the person can still sit in the patient can still sit in the clinic, and just in like 5 minutes or so, when they are actually waiting out there to understand the decision is out there, right? And then they can actually have a follow-up, scheduled at the same appointment. So that's how things could be much more faster and much more efficient. So these are the things, scenarios that we need to always think whenever we are trying to build any kind of AI application, and how the UX can be
So
much more.
considering, yeah, so considering the how notoriously the US insurance sector is perceived generally, it's a good idea to say yes. If you can give me the parameters for a go no go approval with the help of
Right,
AI,
right.
in the positive manner, it is all well and good. That there, I enter the policy number, it refers to what policy entails. AI knows it,
Mhm.
and this person at the clinic, they are entering the information, and if they make a mistake, some information could be additionally sought. But
Right.
can this be used in a negative manner with a negative bias that AI is now looking for loopholes and
Mhm.
trying to save that as little as they could sanction, or just see that what are the ways to decline it? That is the negative annotation of the entire experience.
Right.
One thing positive that it can do is it can ask for clarifications, that if you can give me such and such data points, I can help you. But at the same
Mhm.
time, it can refer to the vast database of medical expertise and say, wait a second, the prescription is wrong, or this may not work, or it's just the way that how it is perceived. If you're looking for negatives, it is going to decline. If it is looking for positive, it will try and see that how much can be sanctioned here. What is
Absolutely.
your thought on this, that those biases, how can you remove them with the help of UX, or it is something that is out of our hands?
It is something which is out of our heads, but at the same time, AI is more like, it can be compared to something like fire as well, right? Like you said, right? It could be used on the negative side, like just like fire, right? Like it depends on how you use it, right? You use it for cooking, yes, there you go, you're getting a lot of things out of that, and you can actually make use of that for generating heat and things like those, right? It's saving your life at sometimes if you're out there in the cold, and right. But at the same time, it could be very disastrous as well, right? I mean, if it's used in a wrong way. So AI is something similar to that, right? Like it depends how and why are you going to use it. If you, like you said, right? Because yes, why do all these insurance company wants to, shell out of their money just so quickly, just because, something has been prescribed, and they're not making any profits out of it if they're doing that kind of thing. But at the same time, if you want to serve in the healthcare industry, right? If you truly want to be a person who is serving, because there is a lot of money involved in there, right? Like obviously you're getting a lot of profits at the same time, but at the same time, if you want to help the healthcare industry, or the people of your country, then yes, definitely, why not, right? You'll be using the AI in the right way, and then the bias could be actually avoided. So that's what it is. But it's again not in our hands, as you rightly said, right? As a designer, we can actually do think of what are the positive things that we can do with it, and how to utilize it, how to leverage it, and all those kind of things. But yeah, that's not something in our hands.
Well, I think this could be researched in depth on the sides where we can say the answer is it just a binary answer, or we are adding a reason to it before saying no, or
Right.
could be the case when we can say, can you please tell me if these are the things and vectors are
Hmm.
applied, because this will help me make a better decision in the favor rather than going in the negative. But it is the holistic responsibility of not the insurance companies, but people who are building on AI and developing it all together. So if those
Yeah.
user journeys are mapped up from the UX point of view,
Yeah.
for a better advocacy for doing a world of good, then it's a
Right.
victory. Otherwise, it's just a slide that you would
Absolutely.
just go
And all
down
these
poorly. I
requirements,
mean,
the requirements are not coming from the IT side, right? The requirements are always coming from the business side, right? We have to remember that.
that's true.
Yeah.
But how negative bias can impact the judgments on all the
Right.
parameters for
Right.
human factors is
Right.
so, like the instance that happened with Gork the other day. I think it started generating indecent pictures of children on prompt in Twitter. And at the same, something funny happened in India yesterday. We have this
Mhm.
mobile app called Digi Yatra. So if
Okay.
you to the airport, you don't have to check in, as in
Hmm.
like boarding stuff. You can check in with your
Right.
phone. The camera looks
Okay.
at you, and you just board the flight. And it was the funny case of twins traveling together, and
Okay.
it identified one, and the for the other it declined and said that just one person allowed per ticket. You can't use it even with different names because the face is the same.
Right. 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 I know.
So they have
The
to go back and then queue it up, and then they made a post about it. But it is
right.
the sort of an edge case that just brings smile to your face and say, listen, this is not going to 100% be accurate by any means that
Right.
you are going to put in the data.
Right.
There has to be an
Now this
alternative
is
method.
correct. Now this is a new scenario that the app that you're talking about, those designers and developers need to work on, right? That's how you get some new scenarios as well as you keep using it.
But then people would say that what is the edge case looks like? How many people are biological twins but identical twins? And
Identical.
when they are traveling, what are the chances the system is going to make a mistake? And do they need to increase the data points when they are recognizing a face or facial structure? There could be minute differences between the faces, which
Yeah.
AI is not looking to address at that
Right.
given point. But yeah,
Right.
it's fun, isn't it?
Correct.
All right. So you said that you do mentorship a lot, and then what are the ways that anybody can get in touch or connect with you?
So right now I'm not mentoring anywhere else, but I am available on ADP list. But like I do not get much time out to have these sessions with them in recent times. So I stopped using that. But yeah, still I'm there available on ADP list. But the best way to reach me is LinkedIn. You can reach to me on my LinkedIn ID at any time. My name is Feras Abdul Khayum. So you can reach on that. And yeah, it's easy to find. We're not much Firaz Abduls in this field. So yeah, that's how you can find me and shoot me any questions you have through message, or you can connect with me and see if we can have a discussion around any kind of things that you're working on or would like to know more about how the healthcare design industry works and things around that. Yeah, I would be happy to help on that.
And any advice that you would like to give to younger yourselves or the
Yeah.
youth who want to follow in on your footsteps, anything that they should look out for?
Definitely. So I think the most important thing for the young designers is not to jump into the designs right away, right? When you are given some kind of task. Even I did that, right? I mean, I'm not saying that I did not do that. I did it many times, and sometimes I do it now as well, right? Like because sometimes I feel yeah I know everything and I jump into it, but that's not the thing, right? I mean, what happens is you always feel that you know what you're going to design, but there are a lot of surprises there behind, right? When you try to understand more about the whole ecosystem, the domain that you're working for, and the this time a different set of users and different set of personas or whatever it is, there always things that are different, right? There are experiences that needs to be designed differently for different people and different even subsections of a particular industry or a domain, right? So what I would like to just suggest or advise all these young designers is that do not jump into the design. Whenever you get hired for an organization, or you are even doing a freelancing work, right? Even if you're a freelancer doing some kind of design work for some industry, try to understand the industry deeply, right? Try to understand the domain really deeply, right? Once you understand the domain deeply, all the answers, the design answers or the solutions that just keep coming at you, right? I mean, you don't need to go back and forth after that, right? If you know the domain really well, you know what kind of problems they might be facing. You will also know what would be the right solution, right? Because, for example, if I'm a doctor and I'm not the person who has designed this application, right? So I would know that I'm facing such certain kind of issue, and I want to see the next patient immediately, right? One by one, I want to see the patients one by one. But I feel, find it really difficult to go back to the home screen, check who the next patient is, open that person's profile, and be able to call them in or see what kind of treatment they need before I call them in, right? But what I would be thinking of at the same time is, hey, why this thing is a different screen and I need to come back to the screen again and again, right? Even though the experience might be great, but when we designed it, the experience would have been great. But as a doctor, I'm thinking, I need to go back and forth for every patient's profile. So I would think that as a doctor that why don't I have a list of all my patients for today on the left hand side, and when I click them, I keep seeing what their profile is like on the right hand side itself without going back and forth, right? This is what I thought as a doctor in real time scenario, right? So if you, as a designer, you understood the domain really well and how they actually work in their real time scenarios at the clinics or hospitals that they are at, and with very like I mean they're like very busy, right? Their primary work is to actually see the patients and do surgeries and all that kind of stuff, and the using technology is only like just like not even 10% of the whole workday life, right? So we need to understand that and design in such a way that we are saving a lot of time for them, and we're not putting them into another frustration, right? So when you understand the domain, these are the kind of things that you would realize, and then you see that when you're actually designing it for them, you also think these perspectives and these situations, and you design the right way for them. So always the domain is the most important thing. Go deep into the domain as much as possible. The answers and the solutions will start coming to you without you actually trying to figure out what needs to be done in your design style.
That's an amazing advice, and I think understanding the domain is the key. And over the period of time, you will accumulate knowledge of different domains, and that
Absolutely.
makes up for the UX designer who would realize that the people are the same, the problems you are solving or bringing to the table almost are identical in one manner or the other,
Right.
and that makes up for a perfect UX professional or UX leader on the way. So
Absolutely.
with that, I thank you very much for joining us for the conversation for us.
Sure,
And
Dushyant.
it was a pleasure hosting and talking to you for this conversation.
Absolutely. It was a pleasure discussing with you all these great things. I know it's been a long time. I haven't discussed all these things because working from home since very long times, and you don't get to discuss all these kind of things and what's happening with the current trend and the market and things like those. But it was really exciting and pleasure to discuss all these things with you as well. Thanks for having me.
And thank you once again. And that was the precise reason, as Feras just described, that why we have this podcast is to just
Yeah.
bring people together, talk to the design leaders, and see what is happening around us because it's a large community and very small world. So we want to
Right.
ensure that when we are going into the conversation, everything is in line with how we are feeling as designers, as design leaders, and as our career progresses. So, with
Absolutely.
that, everybody, that is the end of the the episode, and I hope that you enjoyed the conversation with Feras. He can be reached on his LinkedIn ID, which is written in the description. And with that, I'd say thank you very much. Do like, share, and subscribe. That is something that I've added recently to start saying. And see you next time with another guest with the best of the knowledge, and the fun continues. Thank you.
Absolutely. All the best to you this one.